Hello, welcome to Anatomy DAHAR series. Today's topic is borders and surfaces of the mandible. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Author's note. Anatomy is a subject about structures of different parts of the body, their locations in relation to one another, and their possible bodily functions. Therefore, it is the basic and foundation subject in medicine. Considering the number of structures making up different parts of the body, anatomy is essentially composed of many names and facts. The problem is how to remember them. One way is by reading the text repeatedly, another by using mnemonics, and some follow other means such as discussions, etc. Personally, I believe in the saying, a picture is worth 1,000 words. Anatomy is considered as being composed of structures that can be readily visualized, and the subject can be learned through appropriate diagrams. In fact, learning anatomy without diagrams would be like sailing through uncharted waters without a compass. Learning anatomy from simple, clear, and well-illustrated diagrams may be considered the best way to learn and remember the subject. Studying such diagrams carefully would clearly reveal the locations and relations of the structures in the body and facilitate learning and remembering. Hence, I would like to suggest and advise the readers of Anatomy DAHAR series to try and learn anatomy through the diagrams, as I have provided good enough of diagrams in each topic. Thank you. Abdul Hamid, Abdul Rashid. The mandible continuation. In this slide, we have two diagrams, diagram A and diagram B. Diagram A is the right half of the mandible looking from the right side, that is right lateral view. So, figure A, each half of the mandible is L-shaped. Consists of a vertical part called ramus behind and horizontal part in front. This is the diagram B looking from in front, so you can see both halves of the mandible. This is right half and this is left half. So we can see the ramus of each half, and this is the anterior horizontal part. These two horizontal parts fuse along the anterior median plane and form a horseshoe-shaped body of the mandible. In human and primate, the lower jaw mandible does the opening of the mouth and chewing. However, in reptiles, the upper jaw takes those functions. Parts of the body of the mandible. We have two diagrams here. Diagram A is right lateral view of the right side of the mandible. Diagram B is looking from below, inferior view of the whole mandible. Anterior parts of the body of the mandible. Anterior part of the body of the mandible, this is the one, consists of two borders, upper and lower borders, and two surfaces, external and internal surfaces. Figure A. The upper border is the alveolar process, which carries 8 sockets with 8 teeth on each side in adult. The roots of the teeth cause rounded ridges. The canine ridge, number 2, this one, being the most prominent. Medial to the canine ridge is a shallow depression here. There's a shallow depression here below the incisor teeth and called incisive fossa. The lower border is the base of the mandible, number 4. In figure B, we are seeing the lower border of the mandible. This is the base throughout here. It is thick and rounded. That presents a small depression called digastric fossa, one on each side of the anterior median plane. This digastric fossa is a place where anterior belly of digastric muscles attached. External surface of the anterior part of the body. Look at the diagram. We are looking the mandible from in front. This is external surface of anterior part of the body. It presents 5 features. Number 1, symphysis menti. What is the meaning of symphysis menti? Symphysis means growing together. Menti comes from the word mentum, the chin. Symphysis menti is a faint ridge along the anterior midline, the only site of 2 halves of the mandible fuse. Next is mental protuberance. The symphysis menti expands below into triangular elevation called mental protuberance. That is point of the chin. Number 2. Infralateral angles, that is inferior and lateral angle of this mental protuberance. We have mental tubercle, one on each side. Next is, here is symphysis menti. This is canine ridge. You know that. Between the symphysis menti and canine ridge, below the incisor teeth, we have a shallow area called incisive fossa. We have already mentioned in the previous slides. So we have 2 incisive fossa on either side of the symphysis menti. External surface of the lateral part of the body. Just now we mentioned about external surface of the anterior part of the body. From there we are coming laterally, and we are going to talk about external surface of the lateral part of the body. This is the ramus of the mandible. This is anterior border of the ramus of the mandible. From there, there's a continuation of an oblique line, continues downwards and forwards to the mental tubercle. Next is mental foramen. It is below the interval between the first premolar and second premolar teeth. Here is the mental foramen, about midway between superior and inferior border in adult. It is the external opening of the mandibular canal, which is the passage for the alveolar nerve and vessels. We are going to discuss this one later. The canal consists of alveolar nerve and vessels, and its branches comes through this mental foramen as mental nerve and vessels. External surface of the ramus. We are coming from in front, from external surface of the body to posterior part, which is the external surface of the ramus. It is the posterior vertical part of the mandible, a flat plate of quadrilateral in shape. Each ramus consists of two surfaces, external and internal surfaces, and four borders. Anterior border, which is sharp, posterior border, which is thick, inferior border, it is thicker, and superior border is here. Superior border consists of two upward projections. The one anterior is called coronoid process, number one, and the one posterior projections is condyloid process, number two. Between the two processes is semilunar shaped notch called mandibular notch. Surfaces of the ramus. The first is external surface of the ramus is flat and bears some oblique ridges over the angle, number 4, which are produced by the attachment of the masseter muscle. We have two diagrams here. Both are right lateral view. First is about the masseter muscle. The masseter muscle is attached almost the whole of the external surface of the mandibular ramus. Above and behind the masseter is covered by the parotid salivary glands. The second diagram is about the temporalis muscles, fan-shaped muscle with a very strong and long tendon. The tendon is inserted to the internal surface, apex, anterior border of the coronoid process and along the anterior margins of the ramus of the mandible, almost up to the lower third molar tooth. Here is lower third molar tooth. That means temporalis muscles, tendons is attached to the coronoid process, medial side, apex, anterior border of the coronoid process, and along the anterior border of the ramus of the mandible and extend down up to the lower third molar tooth. Structures attached or related to the external surface of the mandible. This is external surface of right side of the mandible. This is anterior. This is body of the mandible. This is ramus of the mandible. These are two upward projections. This is coronoid process and this is condyloid process. What are the structures attached or related here? Very first one is the masseter muscles, number 1, which is attached to the most of the lateral, that is external surface of the ramus of the mandible. Number 2 is temporalis muscle, very strong fan-shaped muscle, which is attached to the coronoid process, apex, medial surface, anterior surface. Actually, this is the muscular part of the temporalis muscle. Its tendon, strong tendons, comes down, we have already mentioned there, and attach along the anterior border of the ramus and right up to the third molar tooth, inferior part of the third molar tooth. These are all the tendinous part of the temporalis muscular part of the temporalis muscles here. Number 3 is buccinator muscles, continuation from here. This is the buccinator muscles. Number 4, depressor angular oris muscles. We have already mentioned there. This is the depressor of the angle of the mouth, depressor angular oris. Another one is depressor labii inferioris muscle, which depress the lower lip. And then next is very small muscle here, number 6, mentalis muscles attached here, and number 7 is the platysma muscles attached to the base of the mandible. It is one of the muscles of facial expression coming down from the face, crossing the base of the mandible and goes down to the neck up to the second costal cartilage level. Others are, just now we mentioned that tendon of the temporalis muscle, number 8. Number 9 is posterior part of the capsule of the temporomandibular joint. Posterior part of the capsule of the temporomandibular joint. Number 10 is mental nerve and vessels. Here, mental nerve and vessels coming out from the mental foramen. They are coming from the mandibular canal deep inside there. These are mental nerve and vessels coming out from the mental foramen. Next, number 11 is facial artery and facial vein. They crossing here and comes up to the face. And number 12 is mandibular branch of the facial nerve. It's very important. Most of the time, it doesn't reach below the lower border of the mandible. When it comes down to the lower border of the mandible, any incision here can injure this nerve and become the muscle which is supplied by this nerve will become paralyzed. And number 13 is the parotid gland, which is above and behind the masseter muscles around here, that is lateral part of the ramus. Internal surface of the anterior and lateral parts of the body. This is the right half of the mandible. We are looking the internal surface of the right half of the mandible. This is anterior part, which is the symphysis menti. We have already mentioned that this is inferior border of the mandible we call base, and at the base on either side of the anterior median plane we have one fossa each. That fossa is called digastric fossa, attached by the upper end of anterior belly of digastric muscles. This is internal surface of symphysis menti. In the internal surface on the symphysis menti, we have two pairs, that is 4 in number, of small spines are here. That is altogether 4 small spines called genial tubercles. You can see here superior 2 genial tubercles and inferior 2 genial tubercles are here. Okay, next we are going to talk about this oblique ridge. This oblique ridge is called mylohyoid line, which begins from the internal surface of the symphysis menti below the inferior genial tubercles. From this area, which is below the inferior genial tubercle, from there this oblique ridge, which is called mylohyoid line, extends up to the root of the third molar tooth. So this is mylohyoid line, big ridge on the internal surface of the body of the mandible. Above the posterior end of the mylohyoid line, we have a small area here that is the lower attachments of the pterygomandibular raphe. We have already mentioned that one, pterygomandibular raphe, which is extending from the humulus of the medial pterygoid to this little area on the inner surface, internal surface of the mandible. So what is between the posterior end of the mylohyoid line and lower end of the pterygomandibular raphe? Between these two is very important nerve, lingual nerve is located here. Internal surface of the lateral part of the body, continuation. We are looking the same diagram here. This is internal surface of the body of the right half of the mandible. This is mylohyoid line we have already mentioned earlier. Now, behind the posterior end of the mylohyoid line, there is a groove is there, small groove is there, called mylohyoid groove. Along this groove, we have mylohyoid nerve and vessels run downwards and forwards. Then related to the mylohyoid line, one above the anterior part of the mylohyoid line and one below the posterior part of the mylohyoid lines we have two shallow fosses here. The one above the mylohyoid line and anterior to it is sublingual fossa, which occupy sublingual salivary glands. It is below the tongue, that's why we call sublingual salivary glands, located in the sublingual fossa here. Now, behind and below the mylohyoid line is another fossa is there, which is occupied by submandibular salivary glands. So it is called submandibular fossa is here. This is the superficial part of the submandibular gland is located here. Deep part will go around the mylohyoid line, that is the mylohyoid muscles, and deep part is deep to the mylohyoid line here. So this is submandibular salivary glands, superficial part. This is sublingual salivary glands will located here. Muscles attached to the internal surface of the body of the mandible. Internal surface of the body means anterior part of the body and lateral part of the body. In anterior part of the body, that is symphysis menti, internal surface, this is internal surface, it has two pairs of spine. This is superior genial spine, or also known as mental spine, and this is inferior genial spine. Each two spines, one on each side of the midline. So this is superior genial spine, you see from the sagittal section. This is superior genial spine if you are looking from behind. Below that is inferior genial spine pair, and here is inferior genial spine. What structures attached to the superior and what structure attached to the inferior genial spine? Superior genial spine is attached by very big genioglossus muscles, which runs up and attached to the tongue. And what about inferior genial spine? It is attached by geniohyoid muscles. If you see here, this is geniohyoid muscles attached to the hyoid bone behind. Now we are going to talk about the inner surface of the lateral part of the body of the mandible. Here we have mylohyoid line. We have already mentioned earlier, which arises from the back of, that is, internal surface of the symphysis menti, below the inferior genial spine, around this place. So this mylohyoid line started from this area below the inferior genial spine, and it runs up and posterior along the internal surface of the body up to the lower third molar tooth. So this is your mylohyoid line is there. So what structures attach along the mylohyoid line? Yes, it is attached by mylohyoid muscles. So this is the two parts of the mylohyoid muscles. Mylohyoid muscle is like a cutter shape, coming down and meet its opposite part. Below, there's a raphe there. Above this is we have geniohyoid muscle. Above that is we have genioglossus muscle. So most inferior is mylohyoid, cutter. Above it is geniohyoid. Above that is genioglossus, coming from superior genial spine. This one is coming from the inferior genial spine. Internal surface of the ramus of the mandible. We have already presented internal surface of the body of the mandible. Now we are going to present internal surface of the ramus of the mandible. Internal surface of the ramus of the mandible presents two features. Number one, mandibular foramen. This is mandibular foramen, which is located a little bit above the center of the ramus. It leads into the mandibular canal. Number three, which runs through the body and opens on the external surface as a mantle foramen. We have already mentioned that one. The mandibular canal is passed through by inferior alveolar nerve and vessels. At the mantle foramen, these nerve and vessel divides. Some will branch out through the mantle foramen as mantle nerve and vessels. Others will continue forward as incisive nerve and vessels supplying through the teeth, incisor teeth and canine tooth. Second feature is lingular process. Lingular in Latin means tongue. It is a small tongue-shaped projection on the anterior margin of the mandibular foramen. This lingular process is attached by inferior end of sphenomandibular ligament. We will discuss this one later. Muscle attached to the internal surface of the ramus. Look at the diagram first. This is right half of the mandible. This is right temporomandibular joint. This is right ramus, and this is right ankle, and this is right body of the mandible. We are looking from behind, posterior view. The muscle which is attached to the inner surface of the ramus is medial pterygoid muscle, number one. It is quadrilateral shaped muscle, consists of two heads, superficial and deep heads. We are going to talk about its attachment to the mandible. So, medial pterygoid muscles is attached to the internal surface of the angle and ramus of the mandible. Internal surface of the angle and ramus of the mandible as high as mandibular foramen above, this is the mandibular foramen, and as low forward as mylohyoid groove below. The internal surface of the ramus is flat and bears some oblique ridges over the angle produced by the medial pterygoid muscle. Medial relations of the ramus, that is, structures on the medial side of the inner surface of the ramus. Look at the diagram. This is the coronal sections of the right half of the mandible. We are looking from behind. What are the structures? This is base of the skull. This is right temporomandibular joint. This is right ramus of the mandible. This is the angle, that is right side of the mandible, and this is right half of the body of the mandible. So what are the structures on the medial sides of these part of the mandible? That means medial relations of the inner surface of the mandible. Number one, this is maxillary vessels. Number two, this is middle meningeal vessels coming from the maxillary vessels. And number three is inferior alveolar nerve and vessels. Number four, sphenomandibular ligaments. Number five, medial pterygoid muscles. Its lower end is attached to the ankle, and then lower part of the ramus of the mandible, and then cauda tympani nerve, number 6, and number 7 is wall of the pharynx. Borders of the ramus. Look at the diagram. Each ramus has 4 borders. Anterior border, which is sharp, posterior border, it is thick, inferior part, which is thicker, and superior border above here. The superior border bears 2 upward processes. The coronoid process, number 1, and condyloid process, number 2. Between them is a semilunar shaped notch called mandibular notch, number 3. Coronoid process, coronoid in Greek means hooked or curved, crow-beak appearance. It is located in front of the notch. Flattened triangular process with sharp apex attached by temporalis muscle. The condyloid process, the condyloid means in Latin knuckle-like. It is behind the mandibular notch. Attachments of the pterygoid muscle to the temporomandibular joint and internal surface of the ramus. We have 2 diagrams here, diagram A and diagram B. Diagram A is seen from left lateral side. That is, this is anterior. We are looking from the left side. Diagram B is we are looking the TM joint and the left ramus from behind, posterior view. First is lateral pterygoid muscles. This is the one. It consists of 2 heads, upper and lower heads, upper and lower heads. If you see from behind, this is the upper and lower head of the lateral pterygoid muscles. The upper head is attached to the anterior part of interarticular disc of the TM joint. You can see here, in both here, upper head is attached to the interarticular disc. Okay, and the lower head is attached to the pterygoid foveae, which is a little area in front of the neck of this condyloid process. So this is the lower head attached to the pterygoid foveae. Next is medial pterygoid muscle. You can see only in figure A. It also consists of 2 heads, superficial head and the deep head, which is larger. They are inserted to the inner, that is the internal surface of the ramus of the mandible. We have already stated this one earlier. Relations of the condyloid process and temporomandibular joint. We have 2 diagrams here, diagram A and diagram B. This is condyloid process and this is TM joint. This is we are looking from inside and this is we are looking from behind. This is medial view, this is posterior view. Now let's discuss about the relations of these 2 structures. Medial relations of the TM joint and condyloid process. Number 1 is middle meningeal artery, of course together with the vein. And then number 2 is maxillary artery and vein. Number 3 is auriculotemporal nerve coming from the mandibular nerve. And number 4 is sphenomandibular ligament. We have already discussed earlier. Lateral relations of these 2 structures. If you see laterally, we have number 5 branches of the facial nerve is here, which is covered by parotid gland number 6, and they are covered by the skin laterally. Structures attached or related to the internal surface of right mandible. Let's see the diagram first. This is anterior, this is posterior. This is internal surface of right half of the mandible. This is symphysis menti. This posterior surface is internal surface of the symphysis menti. This is internal surface of right body of the mandible, and this is internal surface of right ramus of the mandible. These two are internal surface of coronoid process and condyloid process, and this is head of the mandible. Let's see the structures attached or related to the internal surface of the right mandible. Number 1, medial pterygoid muscles. This is attachments of the medial pterygoid muscle to the internal surface of the angle of the mandible and lower part of the ramus of the mandible. Number 2 is lateral pterygoid muscle. This is lower head of lateral pterygoid muscles, which is attached to the pterygoid foveae, which is on the anterior part of the neck of the mandible. Number 3 is temporalis muscles, which is attached to the coronoid process, to the apex, to the medial surface, and along the anterior border of the ramus up to the lower part of the third molar tooth. This is temporalis muscle will be attached here. Number 4 is a very long muscle, mylohyoid muscles is here. It is attached along the mylohyoid line. Where does it begin? Look here. This is posterior surface of the symphysis menti, just below the inferior pair of mental tubercles. So this area, that is inner surface of the symphysis menti, below this inferior tubercles here, pair of tubercles here, from there mylohyoid muscle extends up and back along the mylohyoid line and up to lower part of the third molar tooth. And number 5 is we have two pairs of spine or tubercle, genial tubercle, superior pair and inferior pair. Superior pair is attached by genioglossus muscle coming from here to the glossus tongue, and the inferior pairs are attached by geniohyoid muscles. And next is number 6, anterior belly of digastric muscle. If you see below here, this is border of the mandible. On either side of the midline, we have two fosses. On one fossa on either side of the midline. This is attached by upper end of anterior belly of digastric muscle will be attached here. Next is number 7. This is number 7 along the base of the mandible, which is not attached by muscle, but it is attached by deep cervical fascia. And number 8, this green color near the third molar tooth is the attachment of lower end of pterygomandibular raphe. It forms a common attachment for two muscles, anteriorly buccinator muscles and posteriorly superior constrictor muscles. And number 9 is mylohyoid nerves and vessels running down along the mylohyoid groove. And number 10 is very important nerve. You can see here lingual nerve. It is between the posterior end of the mylohyoid and lower end of pterygomandibular raphe. Between pterygomandibular raphe and posterior end of the mylohyoid, this is the lingual nerve is there. And number 11, on the medial surface of the neck is, you can see here, that is auriculotemporal nerve coming down here. Number 12 is maxillary artery and vein, so maxillary vessels are there. Number 13, and nerve and vessels of the masseter, they are crossing the mandibular notch here to supply the from inside to outside to supply the masseter muscles. And number 14 is sublingual salivary glands, which is above the anterior part of the mylohyoid muscle, located in the sublingual fossa, sublingual because these glands are below the tongue here, so they are sublingual salivary glands, which is above the anterior part of the mylohyoid muscle, and last, which is submandibular salivary glands, which lies below and behind, that is posterior part of the mylohyoid muscle. This is superficial part of the submandibular salivary glands. It will hook around, and deep part is lying above the mylohyoid muscle here. So this is the superficial part. All these are either attached or related to the internal surface of right mandible. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.